Throughout life, we have accidents or injuries, and it can start with birth, which is very traumatic on a baby's head or neck. First few years of life, when you're learning to walk, you fall 100 times a day. It could be a sporting injury, an auto accident. Something physical has to occur to first misalign the spine. And so whenever that happens, whenever you have a force, the forces will travel throughout your body and affect the area of least resistance. And it's known that the area of least resistance in the spine is between the skull, the first vertebrae, and the second vertebrae. And there's two reasons for that. First, your skull weighs between 10 to 14 pounds as an adult. So you have a very heavy structure sitting on top of a little tiny 2-ounce bone, which is called the atlas. And that's why we have the atlas holding up the world, because it's very similar to the weight of the skull on top of that first bone of your spine. So the head weighs 10 to 14 pounds, and it's sitting on top of a tiny little 2-ounce bone. So that's one of the reasons that it's very unstable at the top of the spine. The second reason is that there are no discs at the top of the spine. The discs are sitting in between the vertebrae, and they act as shock absorbers in the spine. So at the top of the spine, you don't have those shock absorbers. So it's a very unstable area. So what happens is that when you first have any kind of force, the forces will travel throughout your body and affect the area of least resistance. And so the first thing that's going to happen mechanically is that the weight of the head moves. How that weight moves is unique for each individual. That's actually what a NUCCA chiropractor determines. And so when the weight of the head goes off, there's a very, very powerful reflex in the body, and it's called the righting reflex. And what that reflex does is it shifts the eyes back to a level neutral position when the head goes off center. When that happens, the neck moves underneath the head to try to counterbalance everything. Then you'll get spasm or tightness of muscle on one side of the body more than the other. You get a high and low hip, a long and short leg, and then you'll start to get a twisting throughout the entire spinal framework. And so how it twists is unique for each individual. That's actually what I determine. So how we determine how the spine is misaligned is through a series of x-rays. So I take x-rays of the head and neck to actually determine the exact misalignment of the spine, and it's a full spinal technique, although we only have to do it through the top. So we take x-rays at these funny angles in order to do a biomechanical analysis and create basically a three-dimensional picture with 2 dimensions. It's like figuring out the correct combination to a lock. When you have that correct combination, it doesn't require a lot of force to open up the lock. And the same thing with the spine. When you have the correct biomechanics and physics of what's going on in the spine, when you determine that, it doesn't require a lot of force to move everything back into place. So once we've determined the exact misalignment of the spine, then we're ready to make a very gentle correction to the spine. And after the correction is done, we actually post x-ray and measure the change, because we have a goal of bringing the spine to a more neurologically neutral position. And the pre and post x-rays actually show us that. We either have it, we've achieved what we've attempted to achieve, or we haven't. And then it might require that the doctor go back in there and do more work, just depending on what those post x-rays show.